Dr. Russell Samson returns this season from Sarasota Vascular Specialists. Today he is here to discuss problems with varicose veins. Nice to see you, Doctor.
Nice to see you again.
We were saying how quickly time passes.
Sure does.
It does. Well, good to have you back. So we're going to review some of the things that we discussed last year. We're going to start with varicose veins and spider veins. Is there a difference between them?
And there have been some new things, so
okay.
it's worthwhile. Yes, so varicose veins are these kind of ugly, bulging blue veins that you have up and down your legs. Mm-hmm. And spider veins are these little kind of minute little discolorations that actually look like spider legs on your legs. Okay. Spider veins.
Now, do you just get them on your legs, or can you have them? Because I've seen people with them on their faces.
Well, you don't get varicose veins anywhere except on your legs.
Okay.
And why that is, we really don't know. Now, spider veins you can get anywhere, but they are much more common on the legs.
Okay. And they should not be left untreated.
Well, I think that's something people need to understand. Most vein problems don't have to be treated at all.
Even varicose veins?
Even varicose veins.
Even when they're bulging?
Even
they just
when they're bulging,
ugly, right?
they just look ugly.
Okay.
It's very, very rare that varicose veins will ever cause a problem. So you may see things on TV where people are advertising for you to come and get your veins treated, but really those are money-making schemes. The majority of people do not need treatment. Now, some people with varicose veins will have discomfort, they'll have itching, they'll have a sense of heaviness towards the end of the day, and they'll want treatment for reasons other than cosmetics, and I think that's appropriate. Okay. But the majority of people with varicose veins have no symptoms, they just don't like the way they look.
All right. Well, then there are treatments for them or not? I mean, if there's nothing that you can do for them, what type of treatments do you offer?
Well, it's not that there's nothing that we can do for them. We can do lots of things for them. We can do treatments that make them disappear. We can get rid of the symptoms. The point is that not everybody needs them. So if you don't have symptoms and you just have varicose veins and you're worried that maybe something bad's going to happen, you're going to get a blood clot, there are advertisements that say maybe you can die. That's completely false. But if you're worried, you really don't need treatment. But if you have the symptoms, that your legs are heavy, you get itching, towards the end of the day they're uncomfortable and you want treatment, we've got plenty of treatments for that. And there are some people that can get blood clots in varicose veins, but those are not dangerous blood clots, they're just uncomfortable. And that would be another reason to have treatment. Okay. Now, spider veins are purely cosmetic, and we can talk about that again. Okay,
so how somebody should come in then, I mean, even if it's not cosmetic, say they don't like them and they're cosmetic, that's
Correct.
one thing. But they should come in and have them looked at because they don't know whether there are issues such as blood clots or other things?
No, again, that's a come on that a lot of the advertisements try to do. And one of the things I've tried to do and advertise for, and one of the reasons I'm here, is to reassure people that if you have varicose veins and you don't have any symptoms and they just look bad, you do not have to see a doctor, you don't need treatment. If you have the symptoms or you don't like the way they look, then it's definitely worth seeing somebody who's a specialist in it. But I think you need to be careful who you go to, because unfortunately around the country there's a tremendous growth in treatment for varicose veins that was never necessary in the first place. And a lot of people are being harmed because they are having unnecessary treatment. So, as I said, if you have the symptoms, you don't like the way they look, go to somebody who's ethical and will do the right thing. But don't go just because you're concerned that something bad's going to happen to you.
What are the risks of having them removed? I mean, even if it's cosmetic now, let's just stay with cosmetic.
Well, it depends on what treatment is done. So, but the risks, basically, you can get blood clots. You can get a blood clot that is dangerous to your life. You can get scarring from the treatment. And one of the treatments gets rid of a vein in your body, which is not usually the varicose vein, but it's a vein that we think may cause varicose veins. And we do get rid of that vein for some people that need treatment. But that is the same vein that we use if you ever need open heart surgery and you need a coronary bypass, and the doctor has to use a vein as an artificial artery.
So you don't want to get rid of that.
So you don't want to get rid of that unless it's absolutely necessary. Unfortunately, it's a big money-making area for unscrupulous doctors.
So when people come to see you, then what are the reasons? What do you tell them when they come in?
I tell them just what I told you. If you don't like the way they look, or you're having symptoms, then we do a very simple ultrasound test, which is painless, and insurance usually pays for that. And then based on that, we'll determine what type of treatment you have. And most of the treatments are done in the office There are outpatient treatments with return to immediate activity, but there are some risks. So you really should only have them if you're, educated as to what's going on with your symptoms and your veins.
Now, if people are interested in having them done, not all doctors are qualified. How do you determine whether a doctor is qualified or not?
The only doctors that are actually trained and are specialized by recognized American Board of Medical Specialties are vascular surgeons. So that's who I would recommend people go to. There are other doctors that are starting to learn how to do this, but they didn't come to it directly. They may have been cardiologists or family practice doctors, and they've kind of learned the technology. But generally speaking, I'd go to a vascular surgeon.
Okay. Now, on your team, how many vascular surgeons
So
do you have?
we have 6 doctors in our team, all board-certified vascular surgeons, and all able to do these treatments.
All right. And where are you located, doctor?
We're on just North Cattleman Road, just by Sam's, so you can stop off and get something at Sam's and then get your veins treated.
Okay. Do you have a website that they can go to? Because I know you have a lot of information on there as well.
Veinsandarteries.com, all spelled out, or Sarasota Vein Doctor, and you'll come to me.
All right. I like it. Thank you. It was nice seeing you, and we'll have you back soon.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.